I'm going to be presenting, as Marty said, the study that we called, sort of cheekily, coupling with COVID, looking at relationship satisfaction, dyadic coping, and psychological distress during the pandemic. Now, you may, too far. You may ask for yourself, why do we need to think about couples and satisfaction? Well, nearly half of the US population is currently married, and marriage is associated with better physical and mental health outcomes. And this is enhanced by having a satisfying relationship. We know that chronic stressors have been shown to be associated with poor couple functioning and a higher likelihood for divorce. You can absolutely think about COVID-19 as a stressor for couple. The pandemic has produced a number of concerns for couples, including financial, educational concerns, childcare, and everyday activities that folks would engage in for stress relief or even essentials like grocery shopping were now associated with a level of risk. For some households, we see an exacerbation of more traditional gender divide. And we know research has shown us across the board individuals show increased levels of psychological distress as a result of the pandemic. Now, dyadic coping is an interesting variable to look at this point in time because it focuses on the shared experiences of stress for a couple and has a couple of important components. The first is common dyadic coping, when a couple is experiencing a shared stressor together, or supportive coping, when one member of a couple may experience an elevated level of distress. Say, for instance, in the pandemic, one of the couple members is a first-line healthcare worker, a frontline healthcare worker. We also know that couples can engage in what's called delegated coping together, where each one takes on various tasks or duties in an effort to help the family or relationship through the stressor. The use of dyadic coping has been shown to has been associated with higher levels of relationship satisfaction. And importantly, this is above and beyond the effects of individualized coping. So this brings me to the goal of our current project. We're going to examine dyadic coping among romantic dyads during the COVID pandemic and explore how coping is associated with relationship satisfaction and psychological distress. And we gathered participants who were at least 18 years of age and who reported being in some sort of a cohabiting relationship. We collected basic demographic data on them. We measured relationship satisfaction, dyadic coping, and COVID-related distress through two different measures, one that did COVID general anxiety, and then obsessive compulsive behaviors as related to coping. As related to COVID. I'm focused on coping. And then lastly, we asked couples to just an open-ended question. Tell us about your experience coupling with COVID. And then we collected our data online, where participants were presented with the consent form, the survey, and then a brief debriefing. And we used snowball sampling. So one person could sort of share the study with other people, and it was kind of word of mouth. In total, we had 513 participants who were mostly women who were heterosexual, married, and working full-time. We didn't find any other differences across demographic variables, except women reported significantly more COVID-related distress than men. One of the first things that we did was to look at that qualitative data, so the open-ended question. And about half of the couples who answered this question reported that they were happy at home during COVID. The other half of the couples reported a significant number of stressors or issues of concern, just COVID in general, caregiving concerns, issues related to themselves working from home or their partner working from home. And when we compared those two groups, we find that those who are sort of happy at home show higher levels of relationship satisfaction and higher levels of dyadic coping, but no difference in COVID-related distress. Now, if you're not a quantitative person, I'm going to sum this up for you in a second, but here are some basic correlations amongst study variables. And like I said, there are a couple of things I want to point out. In the gray boxes, you can see that for men who are below the diagonal in blue and for women above the diagonal in red, um, as expected, dyadic coping was associated with relationship satisfaction. It's great. But in yellow, you can see that relationship variables for women, not men, were associated with COVID-related distress or those obsessive compulsive symptoms related to COVID. This was really interesting to us, so we decided to try to understand this a little bit more. And we ran an interaction or a regression effect to see what was really happening between dyadic coping and relationship satisfaction. So at low levels of dyadic coping, relationship satisfaction really wasn't associated with COVID-related obsessive compulsive symptoms, but at high levels of dyadic coping, relationship satisfaction was negatively associated with OCD. But now here things get a little complicated again, because kids come into play, and the impact of children in this study was huge. So as you can see, there is differences between individuals in the study who have children and who don't on the level of OCD related COVID symptoms, relationship satisfaction, and dyadic coping. So those without children are showing higher levels of relationship satisfaction, more dyadic coping, but more distress. Now we wanted to put these pieces together. How are these variables coming together to predict distress? And what does this mean for women, where that relationship was there initially? So we ran separate analyses for women with children and women without children. And what we found is that for women with children, low dyadic coping and low relationship satisfaction was not associated with COVID-related obsessive compulsive symptoms. But at high levels of dyadic coping, we see relationship satisfaction being negatively associated with distress. And more importantly, this relationship was not significant for women with children. You might be saying at this point, okay, tell me what you just told me. So some couples are happy at home and thriving during the pandemic. Our study showed that relationship dynamics predicted distress for women, but not men. And as expected, increased dyadic coping was associated with more distress in the context of low satisfaction for women. We think this might be due to kind of forced coexistence. If I'm not happy to begin with and I have to cope with the COVID pandemic with my partner, it makes sense that I might feel more distress. And lastly, children were associated with poor outcomes overall, but for women with children, the combination of dyadic coping in the context of a satisfying relationship may buffer the effects of distress. What do we do now? One, we pay attention to relationships, help couples cope, and also attend to the unique stressors that women with kids might be experiencing. Our team is also thinking about how we might be able to look at congruence between couple members. So if my partner is meeting my specific needs that I have during the continued pandemic. Just a quick thank you to my research team, Charlie Gerard, who is a recent grad from our master's program, and Kristen Abraham, a current undergrad student. I want to thank the participants themselves and all of our friends, family, and colleagues who shared our study link.